Good afternoon, everyone, and welcome, graduates of the School of Public Health. Congratulations. For those of you who don't know me, my name is Perry Halkitis, and I am the very proud Dean of the Rutgers School of Public Health. On behalf of the faculty and staff, I welcome all of you to our convocation that celebrates the accomplishments and achievements of the class of 2025. You can keep applauding. Members of the Rutgers community, please be reminded that this university event is taking place to celebrate the culmination of our students' hard work and earned degrees. It is a momentous event for many graduates and their guests. Activities that disrupt the ceremony will not be tolerated. Sorry. It's not really on brand for me, though, right? Please remain standing for the national anthem and lift every voice.
Lift every voice and sing till earth and heaven ring, ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of a new day begun. Let us march on till victory is won. God of our wearies, God of our silent tears, thou who has brought us thus far on the way, thou who has by thy might led us into the light, keep us forever in thy path, we pray. Lest our feet stray from the places, our God, where we met thee. Lest our hearts, drunk with the wine of the world, we forget thee. Oh, shadow beneath thy hand, may we forever stand true to our God, true to our native land. Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming. And the rugged red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Please be seated. Before we begin, I'd like to welcome Dr. Rafael E. Perez Figueroa, Associate Dean for Community Engagement, Population Health, and Public Health Service to read the Rutgers University Land Acknowledgement. Dr. Perez-Figueroa.
Buenas tardes. Thank you so much, Dean Halkiris, and congratulations, graduates. The Rutgers School of Public Health is committed to the history, present reality, and future possibilities between indigenous people, this school, the land, and the environment. We acknowledge that the land in which we stand today is the ancestral territory of the Lenape people. We pay respect to indigenous people throughout the Lenape diaspora, past, present, and future, and honor those that have been historically and systematically disenfranchised. We also acknowledge that Rutgers University, like New Jersey and the United States as a nation, was founded upon the erasure and exclusion of indigenous people. And while acknowledging this, we commit to work in the pursuit of equity and justice. Dean Halkiris.
Thank you, Dr. Perez-Figueroa. I don't know about you graduates, but the last few months have been a little bit exhausting. Who's ready for a party? Let's do it. Graduates, honored guests, family, and friends, welcome to our celebration. Take a moment, graduates, reflect on what you have achieved, what this milestone means for you, for your families, for your mentors, and for all of us who are gathered here. Today marks my 8th graduation as dean of our school, and together we've done remarkable things. We've grown in prominence, we've grown in purpose, and most importantly, we've grown in relevance. Guided by our unofficial motto, keeping the public in public health, we've taken bold steps forward, and it's paid off. After decades, ranked in the 30s and 40s, the Rutgers School of Public Health now proudly stands as the number 16 school of public health nationally. And with continued innovation and our unshakable commitment to humanity, I believe we will reach the top 10. But let's be clear, higher education is at a crossroads. As journalist Masha Gessen implored academic leaders, bring education to communities, create a base, become a movement. That's exactly what we've done. We've built a modern school of public health on 2 foundational principles, social justice and health equity. Not by mimicking others, but by building something new, something relevant, something deeply human. But change, real change, is always met with resistance. Since January 20th, 2025, we've seen attacks on the very values we hold dear. Rights are being chipped away from women, from people of color, from LGBTQ+ individuals, from immigrants, people with disabilities, and the working class. And to that I say, hell no, not on my watch. As long as I am dean, we will build programs that matter, engage communities we respect, and call out injustice whenever we see it. In these moments, I remember my mother's voice. With her Greek accent, she often told me, "Perimu, we may disagree with people, we may dislike them, but we never hate them." Hate is a virus. It spreads, it divides, it harms health. We may be astonished by immigrants who vilify newcomers seeking the very opportunities they or their families once pursued. We may be baffled by politicians who claim authority over a woman's body or dictate whom someone may love, while at the same time insisting that government should censor the research that fuels discovery and enhances our health. We may find ourselves bewildered when a highly educated mother trusts information on social media over the proven science of vaccines, choosing not to vaccinate her son, knowingly placing him in harm's way. And we may be disheartened by those having risen from modest beginnings who now call for the dismantling of the very programs that once enabled their success, programs still vital for those walking the same path they once did. Yes, these contradictions frustrate me. They anger me, and at times they deeply disturb me. In a nation where hate runs rampant, health outcomes are deteriorating. Longevity is declining. Trust is eroding. Public health and you must confront this hate head on. But confronting hate isn't about yelling louder. It's about leading with empathy, with understanding. It's about engaging with those we disagree with, not dismissing them, but reaching out to them, changing their hearts, opening their minds. We in public health must be the force of altruism and empathy. We must care for everyone. We must understand their stories, and we must help them choose health for themselves, for their families, and for their communities. These are the ideas that I explore in my upcoming book, where I examine the lessons of COVID-19, HIV, and other modern-day pandemics. As I argue in the book, we cannot rely solely on biomedical advances. Important as they are not enough. To truly move the needle on health, we must also center trust, community, compassion, and political will. This work, the work of advancing justice and health, is embodied by leaders like Governor Jim McGreevey, who you will hear from today. A man once undone by hate, now lifting up those burdened by incarceration. That's public health in action. The moment is a full circle moment for me. On the very day that Governor McGreevey's life was being dissected and dismissed in the headlines, I was in a car with my mother being interviewed by a New York Times reporter. When the interview ended, my mother gently reached over and placed her hand on my shoulder. She said nothing elaborate. She simply beamed with pride. My immigrant mother, a woman with only a 6th grade education, who could not possibly grasp all the nuances of my identity, could have chosen silence. She could have chosen shame, but she didn't. She chose love. She rejected hate and embraced me, not despite my difference, but because of it. And it's this kind of love, radical, unflinching, and deeply human, that fuels my work in public health. Because hate does more than divide. It makes us sick. Hate kills. And only love, in its most powerful, justice-driven form, can heal us. So I say to you, class of 2025, be loud, be proud. Be a scientist, a practitioner, an activist. Lead with your heart and your mind. Fight for justice. Uplift the forgotten. Lead with compassion, because it is simply the right thing to do. Graduates, I am proud of every one of you. Now go out there and make the change that matters. Go out there and lead with love. As I conclude my remarks, I'd like to take a moment to welcome and introduce our new Vice Dean, Dr. Deanna Kerrigan, who will be joining us in November but is here with us today. Dr. Kerrigan is a distinguished public health scholar who has led numerous NIH-funded studies focused on developing community-based interventions, especially for marginalized women in the United States, Latin America, the Caribbean, and Sub-Saharan Africa. She joins us from the Milken Institute School of Public Health at George Washington University, where she served as professor and chair of the Department of Prevention and Community Health. With Dr. Kerrigan's leadership and partnership, I am confident that we will continue to expand our impact and reach even greater heights. Welcome, Dr. Kerrigan. I leave you with one final suggestion, not made by a philosopher or a historian or a scientist or even an influencer, whatever that means, but by my amazingly intuitive and intelligent parents who gave me many gifts, the greatest being the confidence and the ability not to be afraid. So in this moment, when demons surround us at every corner, I ask you all to be fearless and fight for those who have no voice, fight for those who have no power, and fight for the soul of our country, uplifting the diverse, beautiful life experiences, cultures, languages, and religions that make our country great. It is now my honor to introduce our next speaker, Dr. Kaitlan Baston, who is the most recent past commissioner of the New Jersey Department of Health and is now interim president and CEO of University Hospital. Dr. Baston, the podium is yours.
Wow, what a day, huh? How are you all feeling? Thank you. I think, is that it? How are you really feeling? That's great. And a lot of thank yous, of course, are going to follow. One for that better, how you're feeling. That was good. It is time to celebrate, as we just heard from the dean. I also want to say a huge thank you to Chancellor Strom in his absence. I got to speak with him earlier today, and he remains a friend and partner. And your incredible dean has been a wonderful partner to me throughout my career and at my time at the Department of Health. And after hearing him speak, which is hard to follow, I am just even more thrilled than ever to continue that partnership. So thank you deeply. And of course, to the faculty and staff of this exceptional school, thank you for getting all the students here today. To the family and loved ones, thank you for your support for getting them here today. And especially to the students, thank you for choosing this path and for putting the work in to get here today. We need you. No pressure. In all seriousness, it's important to take moments like this and ground in them. As I'm reflecting from the last time I was in your shoes, graduating from medical school, it is so important to ground in these pivotal moments with, of course, all the challenge, but also a bit of the safety and security that comes with the school and the knowledge behind you. And what comes from those moments of mentally massaging ideals and thinking about what the world should be and what's in front of you. This incredible opportunity, of course, the challenges, but the privilege of doing the work, world-changing work. And that is a privilege that I have learned to not take lightly in my career. Because having a career where you're doing both things that fill you up and also things for the community is fulfilling in a way that only we really get to experience when we do that work. And I will tell you, I've gotten to experience that in lots of ways in my career. From the front lines of working in federally qualified health centers and hearing whispers from mothers about not being able to afford medications for their kids, to holding the hands of my patients with opioid use disorder who are struggling for their lives after going to program and clinic after clinic, time and time again, never being offered the life-saving treatment, the medical treatment that they deserved. To seeing how water, clean water, or lack thereof, can change the prospects for an entire community without them even knowing sometimes. To working on the front lines of healthcare, to policy, to public health. To strive for a state and I've had the privilege to do this in New Jersey, to strive for a state where health, not just treatment of sickness, is available to all people. And to be clear, we can make this a reality, not just so that it makes moral sense, but so that it makes financial sense to all of us. You are graduating into a battlefield, as we've talked about and as we've heard. And some of you may hear from others that this is not the time to go into public health or to have chosen this career. But I can tell you from personal experience and lived experience day to day, there is no better time. This is exactly the time to go into public health and to lean in. I learned early from those stories and practicing as a physician that I could not work in this system without working on this system. And that is what you are all perfectly poised to do. We have a broken system. It's not perfect. We have, in one of the wealthiest countries in the world, 1 in every 5 households with children don't have enough food. We know, and I know you all know because you're graduating from public health, that in some of our zip codes in New Jersey, the median life expectancy is over 90 years. And in other neighborhoods just miles away, half of their population is not expected to live beyond their 60s. In one of the wealthiest countries in the world. These are not natural disasters that we have to contend with, the ones that I at times had to contend with as a commissioner that we can't prepare for. These are policy decisions. And in public health, you are poised to tackle these policy decisions. And I'll tell you that I have learned through my career to take those moments and really lean in, that the more broken something is, the more I see it as multiple opportunities to lean in and fix it. And I, of course, have a passion for treating addiction. That's my background, and leaning in there. And the things that you choose where you will lean in may look different. But I implore you to find those problems that light you up inside and to dive deep and to take a few things with you as you're fixing them. We can't just fix them with ideals. I like to say you have to get from pie in the sky to rubber hits the road. And we have to do it in a way that makes sense, right? That makes sense for all people, to bring people together, to lead with love. And I'll give you just one example of a brilliant way that I saw this happen in my work under the Murphy administration. And we have incredibly devastating food deserts in New Jersey. And I was working in my early career in the most severe of them in Camden, New Jersey. And time after time, we tried to do business planning to say, through that business planning, can we get a grocery store here? You know, does it make financial sense? Maybe it's tax breaks, maybe it's something else. We tried over and over, the community tried to bring a grocery store to Camden. And the business plans failed. They just kept saying, nope, we're not gonna do it. It doesn't make financial sense for us. And we could have kept trying because the ideal is to break that down in that same way. Or we could be creative and think outside the box. And that's exactly what I saw happen in this administration. The Department of Health partnered with the Department of Economic Development Authority, Economic Development Authority, to make a grant to build out corner stores in Camden, to make sure that they had refrigeration, but not to stop there, to make sure that they had the business plans to support healthy food, to partner them with local agriculture so that also the rural areas were supporting this entity and this program, and to make them make business and financial sense so it was sustainable. So with a small investment up front, we supported local businesses, we got food to the communities where they were needed, and it was sustainable. We didn't have to keep pouring money in, it was doing it for itself. And then those local business owners were thriving. That is doing it in a different way. And that is coming up with a way to make the pie in the sky ideal, make moral and financial sense for all of us. And nobody can argue with that. So we'll all go forward with these ideals and do it in the way that RBG told us, to fight for what we believe in, but to do it creatively and in a way that brings others along with you. If you fight the people against you, they'll feel against you. But if instead we don't fight them, don't do it. Just do it in a way that comes along, that everybody wants to follow you to where you're going in the end. So I won't promise that the path forward will be easy. You will hear no, you will hear you can't, you will hear the regulations don't let you do that. The billing isn't sustainable, this doesn't work, that's not sustainable. But there is a way. I've learned it, I've seen it, I've lived it. There is a way to get to yes. So while it won't be easy, of course, it will be meaningful. Find that way, ask the questions. It is your time to build that legacy. Jersey needs you. The world needs you. I'll see you out there.
Thank you, Dr. Baston. One of the first emails I received when I assumed the role of dean was from our next speaker, and someone who I turned to for sound advice. Dr. James Doherty is the former chair of Rutgers University Board of Trustees and a current member of the Rutgers University Board of Governors and the Rutgers School of Public Health Dean's Leadership Council. He's also involved in many organizations on campus and recently gave $3 million to fund the, who's that Perry and Halkitis? An endowed chair in LGBTQ+ public health at our school, which will be key in launching the planned Rutgers Institute of Sexual and Gender Minority Health. Oh, right, because there are gay people and trans people in the world, right? Dr. Doherty is a great spokesperson for our school and someone who has become a truly wonderful friend. He knows how to manage me really well because he has a Greek husband, so he knows how to deal with me. He also brings greetings from the governing board of the university, Dr. Doherty.
Thank you, Dr. Halkitis. I have to say, I'm going to ad-lib for a few minutes. I don't have anything almost new to say after the past two speeches. They've really hit on some really important topics, but let's forge ahead and see what I have to say anyway. Dean Halkitis, Governor McGreevey, members of the faculty, students, family, friends, and distinguished guests. I'm pleased and humbled that all of you have joined us for this celebratory afternoon. First, I'd like to congratulate Dr. Dean Halkitis on a beautiful and successful convocation ceremony, his 8th at the helm of the School of Public Health. And during this troubling time for public health, Dean Halkitis' perspectives and experiences are crucial in guiding our school to provide our students with relevant, forward-thinking, and transferable skills that are much needed and sought after. Since Dr. Halkitis has arrived, the school has grown in size and stature. He has recruited stellar new faculty, supported the development of new areas of study at the school, such as LGBTQ+ health, population aging and mental health, and pharmacoepidemiology, and ensured that students are receiving an education and experience that is rooted in social justice and health equity in all their initiatives, both locally and globally. Plato is often quoted as saying, "Knowledge without justice ought to be called cunning rather than wisdom." Again, knowledge without justice ought to be called cunning rather than wisdom. And we believe, as Plato suggests, that those who learn are then obliged to act. It's an ideal that Dean Halkitis repeats often when he speaks about public health as a discipline rooted in social justice and health equity. We are a discipline that embraces the idea that a long and healthy life should not depend on where people live, how much they earn, who they love, or their ethnic background. Reality does not always live up to that expectation. Today you are joining a community of people who are committed to promoting health and wellness. We are a community driven by research, education, and service. We hope that in your time at the Rutgers School of Public Health, you have learned not only the hard skills necessary to advance public health as a discipline, but also have come to appreciate the human elements that give our work meaning. We are a community that strives to learn about what drives both health and the lack thereof. You are about to embark on a journey where you will use your knowledge and perspectives to shape policy, promote health, and protect dignity. I can't promise you that that's always going to be easy. There's trials and frustrations, but never lose sight of the fact that your skills are necessary. You are needed, and you will always be needed, even during times when our society seems to be led by misinformation rather than science and truth. I remind you that the school you are graduating from today stands committed to scientific rigor, evidence-based research, and the fundamental rights and dignity of all people and populations, including immigrants, the LGBTQ+ community, and more. That's in that same group. I believe Steve Jobs' quote from a 2005 commencement address at Stanford is also applicable to all of you. Stay hungry and stay foolish. Stay hungry is to have a want or need to have something or make something better. Stay hungry for what's right, for being your true self, and for pursuing your full potential. Stay foolish is to not be afraid to make mistakes. Don't listen to "it isn't possible" or "no one ever does that." Stay foolish, you will have a life filled with curiosity, knowledge, and purpose. Today marks our school's 40th Convocation. This past Sunday, we marked the 259th commencement for Rutgers. I hope that many of you were able to attend that ceremony. We couldn't be prouder of our esteemed faculty, staff, and our nearly 3,000 alumni whose influence reaches from our own communities in New Jersey to every inhabited continent the world over. And we couldn't be more thrilled to embrace these new graduates today. Graduates, when you leave this place today, we do so with a relationship that has forever changed. We are no longer professors and students, mentors and proteges, but colleagues. We are united by an indelible common bond, dedicated to improving the quality of life and in turn, quality of life everywhere. We are so thrilled and honored that you chose us and that we are able to share in the celebration of your successes with you, your family, and your friends. On behalf of all the administration, faculty, and staff of Rutgers University, congratulations. Thank you.
We appreciate your support. And now, the Oscar goes to, wait, sorry, that's the wrong ceremony. I got lost for a second. I would like to now introduce you to our class speaker. You guys ready? Mustafa Diallo. Will Mustafa please join me on the stage? Let me tell you about Mustafa as he comes on stage. Mustafa is receiving his Master's of Public Health degree and will be providing today's address to the class of 2025. He is also the 2020, you can come closer to me, I took a shower, it's good. He is also the recipient of the 2025 Stanley S. Bergen Jr. Medal of Excellence, which honors a graduating student for distinguished academic achievement and contributions to the school and community. That's that lovely medal he's wearing there. Mustafa, the podium is yours.
Dear families, faculty, staff, esteemed guests, and fellow graduates, it is a privilege to stand in front of you to deliver this speech. For each of us graduates, today is the culmination of a series of moments, small and big, made up of choices and encounters, starting before our time at Rutgers and continuing here. Each moment, as small as it may be, has contributed to us being here and now. Whatever has inspired us to become public health professionals, the support we receive from our loved one, the guidance from the incredible faculty and staff at Rutgers, or the tipping point in our learning journeys. Everything before, to some extent, has mattered. This moment, here and now, is a remarkable individual and community success. Congratulations, graduates, for your commitment and hard work. Congratulations, families, for supporting your graduates through this journey. Congratulations, faculty and staff at Rutgers School of Public Health. You did it again. You have trained another class of public health professionals. Like many fellow graduates, I started my journey at Rutgers 2 years ago, full of hopes and uncertainties. Like many international students, I moved to America to study public health. Although this was a significant change, I had experienced something similar years earlier when I left my country, Guinea, in West Africa to study medicine in Morocco, after scholarship out of house school. I was excited and grateful to have been awarded the Fulbright Scholarship to study at Rutgers. At the same time, I was sad to leave my loved one, and I felt some anxiety about how things will turn out. I am sure each of my fellow graduates had their own thoughts. Even though those thoughts were unique to each of us, they share similarities in the underlying emotions: joy, sadness, anxiety, gratitude, excitement, and hope. I am sure all of us have felt some or a mix of these emotions before and during our journeys here. I am sure all of us are deeply grateful for the care and understanding we receive from our loved one, like I am to my beloved wife, Habi, who with my family has given me unwavering support. I grew up in a low-income neighborhood in a West African country. This meant facing many hardships at a young age. However, I was fortunate to go to school and discover that I had a curious mind. My fondest childhood memories are of being alone in my room, reading by candlelight. I remember being completely lost in books. Like many kids, I also grew up watching television and playing video games. I'm sure I was affected by the same cartoons, Japanese anime, movies, TV shows, and video games that shaped many childhood in America or abroad. Like any human being, anywhere and at any time, regardless of background, all I needed was to understand the language to relate to the characters and emotions. On the surface, my daily life as a West African could not have been more different than the lives I was immersing myself in. Yet, I could relate, sometimes very deeply. This lies at the core of the human condition. We are each a particular story, but we can relate to one another because we share this earth for a limited time, and we have an incredible capacity for empathy and compassion. This is what makes art and fiction so powerful. It's why we are still all mad about the finale of Game of Thrones. It's why, like so many people to this day, when I read Marcus Aurelius' Meditations, I'm moved. Though I'm not an emperor of the 2nd century, obviously. Thanks to the wonderful Rutgers community, I have been blessed with impactful learning experiences and meaningful connections during my time here. I want to highlight 2 experiences, keeping in mind that many others had an impact on me. I had the opportunity to contribute to Professor Schwander's research project on tuberculosis and air pollution in Uganda. Seeing the study team make progress weekly despite challenges is a testament to the power of global health collaborations to address complex problems. I was blessed to work with promotoras, who are female-speaking community health workers, on Professor Raphael's research project to address health inequities in New Brunswick. Watching the promotoras give so much to the community, despite daily challenges, was inspiring and taught me how generosity can be empowering. We live in a time more than ever where we must exercise our capacity to listen and understand each other to build a safer and healthier world. Because of who I am and where I was deeply affected by the deadliest Ebola epidemic that severely impacted West Africa in 2014. But as fellow humans, you can relate and contribute to what you can from preventing this from happening again. Just as I can relate to the painful impact COVID-19 had in America and can contribute what I can to avoid this from happening again. Depending on the issue, you and I may not be affected in the same way. You and I may not be able to do much individually, but we can listen, we can learn, we can show empathy, we can act with compassion. Through our shared understanding, we can build communities that can accomplish the impossible. After all, nothing human is foreign to another human. Fellow graduates, as public health professionals, we have the challenging responsibility of safeguarding health, anywhere and at any time. Remember, life is made of moments, of choices and encounters. Let's treat each as learning experience. Let's try to listen. Let's try to understand. Let's try to help as much as we can. Let's use our work to make a difference, whether in America or abroad. Let's leave something fertile that will blossom in each person we will meet. We are truly measured through our impact on others. Ultimately, that's the only thing that stays and is passed on, from one person to another, and so on. To each of my fellow graduates, let's continue our journeys. Although we will each walk our path alone, as a community, we will always be part of each other's journeys as we share the earth and our common humanity. Let's go out there and make public health not just a profession, but a promise. See you around, Scarlet Knights.
Thank you, Mustafa, for your incredible words. You know, every single one of you out there is going to contribute in the way that Mustafa has raised, and we're really incredibly proud of every single one of you, and we will be acknowledging you all individually in just a short amount of time. I have one more presenter I'm going to present to you today, who is our Senator Frank Lautenberg Annual Award and Lecturer in Public Health. In 2001, the Rutgers School of Public Health established the Senator Frank R. Lautenberg Annual Award and Lecture in recognition of the leadership on public health issues that Senator Lautenberg provided in Congress. So most of my good ideas happen when I'm on a spin bike. And this good idea happened during a Lady Gaga ride. Who has Lady Gaga tickets for September? I do. Okay, so not the $800 ones, that was too much for me. So it is my honor to, and privilege to announce Governor James E. McGreevey, former governor of New Jersey and a dedicated public health servant and advocate for social equity, as the 2025 Senator Frank R. Lautenberg Annual Awardee. Governor McGreevey, will you join me at the podium? So first I'm going to give you this lovely plaque, which I'll put on the side. Would you like to hold it?
No, that's okay.
Okay, that's fine. He's like, it's not an Oscar, Halkitis. Governor McGreevey's work reflects a lifelong commitment to public service, leadership, and community advocacy. Having held key roles in government and nonprofit sectors, he has worked to implement policies and initiatives that promote social equity and justice. His extensive experience underscores the impact of strong leadership in addressing societal changes and challenges and fostering sustainable public health solutions. As the executive director of the New Jersey Reentry Corporation, Governor McGreevey has played a pivotal role in supporting individuals transitioning from incarceration, addiction treatment, and military service. Under his leadership, NJRC has expanded throughout New Jersey, offering critical services such as healthcare access, employment training, and sober housing. His efforts have contributed to measurable improvements in rehabilitation and reintegration, aligning with the broader public health goals and emphasizing holistic community well-being. In addition to his work in New Jersey, Governor McGreevey's contributions to policy and governance have shaped conversations around public health, criminal justice reform, and equitable access to resources. His leadership demonstrates the transformative power of advocacy and structured support systems in creating opportunities for underserved populations. It is an enormous honor to welcome Governor Jim McGreevey.
Thank you very much and good afternoon. First thing I'd like to say is to all the graduates, can we have a round of applause for your families? And to Dean Halkitis, this school has climbed in stature and reputation and ranking because of the vision of this dean. To Dr. Doherty, Dr. Baston, and most importantly, the graduates. There was a time in the American experience when the critical concern was simply employment. And for sons and daughters and grandsons and granddaughters of immigrants who came to this nation, it was the value of hard work and leaving to our children and grandchildren a quality of life that was even better than when we had found it. But what we understand today is that it's not only the ability to work and live productive lives of meaning and purpose, but also to share in that great dream of healthy living. The reason why public health is so critical, and all the science and the demographics and the research demonstrates it, is that if individuals do not possess that quality of health, whether it's longitude, whether it's function, whether it's engagement in the community, they are short-ended. And if I can share with you 3 simple examples. I had the privilege of working with the New Jersey Reentry Corporation that works with individuals, whether military service, coming back from prison and jail, or addiction treatment. The first case deals with a young Marine from Ocean County who was at the Marine Corps base in Mount Fuji that was ravaged by a tsunami. The American Embassy sent these young Marines to clean up the radioactive waste. These young men and women, 18 and 19 years old, simply had a plastic sheathing with a Geiger counter. They thought they were indispensable. This one young Marine was there for 2 weeks cleaning up intensive radioactive waste, and he began to feel over his body a sense of discomfort, a sense of unease. He literally shared with me that he felt different. Started drinking, slight drugging, And the United States Marine Corps made the decision to issue him an other than honorable discharge, simply because, as would make sense to the Marine Corps, that he was unfit for duty. But what happens with our veterans is that it's the Department of Defense, not the individual branch of service, that determines the scope of benefits. So Darren was discharged with something called other than honorable. And that meant, despite his service to the United States and the United States Marine Corps, that he would get no benefits. He would receive no benefits. And I had the occasion of meeting with Darren and his young 8-month-old daughter and his young son. And he told me he'd at best have another year to live because the doctor had diagnosed these nodules, cancer nodules, throughout his body. The point being here is, for this young Marine, his inability to access health care, public health, whether from the Veterans Administration or from Medicaid, meant that his life was shortchanged. The second individual was an individual that I had known. He grappled with addiction the entirety of his life. He went through the STEPS program here at Rutgers University. He had been in and out of prison and addiction treatment and battled heroin and fentanyl addiction. And there was a time when he came out of prison, he had a script for medicine, but he didn't have the Medicaid card to authorize the filling of the script. And so he went into to receive a dose of heroin, and he tragically died of an overdose. The next woman, however, is a young woman who was in prison but made the decision to change her life. Had the opportunity to meet Dr. Gloria Bachman of this institution, who helped to navigate her care in terms of OBGYN and cancer care, and now has been reunified with her daughters, works at a local pancake house, and is going to community college. The point that I'm trying to make is that healthcare, and Americans have moved considerably, Democrats and Republicans and independents, to understanding that without healthcare, we can provide the requisite ability for all of us, as families, as seniors, as young people, to achieve what it is we are meant to achieve. And so today, there is a great debate happening in the halls of Congress throughout our nation. And Medicaid has been a source of support, as has been Medicare, supported by both Republicans and Democrats and independents for many years. But understanding the fundamental importance that if people who are in a lower socioeconomic status are trying to climb up without health care, one cannot achieve the capacity for work, for dignity, and for functioning. And why public health is so incredibly important, and your work is essential. Because more than any person's, you will see up front and close the difference from persons who are sitting in an emergency department without the benefit of Medicaid or health care, and the prospect of a young family walking into a federally qualified health center and receiving a vaccine, whether that person is a senior or young child. And so what the dean does here today and what you do here today is to march forward. Because if we believe in an America and a world where every person will achieve the full measure of their talents, they first have to be healthy. They first have to access health care. And so, graduates, whether you see that young Marine will most likely possibly die because of inaccessibility of health care, or you see a young woman, a senior citizen, or young child access health care because of Medicaid or public health, that's two very different visions. And I would argue that public health is the most prudent expenditure this nation can make. Because a minimal expenditure on preventative care, a minimal expenditure on health care outside of the emergency department, outside of the emergency room, in the ordinary course of OBGYN, in the ordinary course of cardiology health care, will help preserve the dignity and the life and the health quality of a child, a middle-aged person, or a senior. It's tough growing old. And so, I beg of you, the challenge before you is serious. We understand the consequences of addiction. We understand the consequences of mental health. We understand the consequences of COVID. And you stand as the bulwarks, as those individuals who will advocate for a better country, a better world, a healthier country, a healthier world. So your challenge today is to understand the dignity and worth of every person, to understand that access to health care is not a distant privilege, but ought to be a fundamental right, and that in granting that cost-effective measure of health care, we will at long last ensure the dignity and worth of every person. To graduate from Rutgers School of Public Health is a testament to your intellect, to your hard work, and to your passion. But on this day, I ask you to commit yourselves, as the dean said, to be filled with a sense of humility for the significant task before you, but a sense of courage, because it'll be your humility and your courage that will promise that young child, that family, that senior, that Marine with a capacity of health care to be all that that person could potentially be. Thank you and Godspeed.
Come on, let's hear it again for Governor McGreevey. Come on. So, what have we learned today? If you open your phone, there will be a Qualtrics quiz on there. No. Love, compassion, empathy, bravery, social justice, diversity, equity, and inclusion are not bad words. They're beautiful words. And no bully is going to tell me to stop using those words ever in my life. Now, so we've done talking, bye. No, but we are finished with our wonderful speeches, punctuated by the amazing speech of Governor McGreevey, and now, you know what? Dua Lipa's coming out. No. We have come to the time to recognize you, our graduates from the class of 2025. Where all of you I know, because I know some of you very, very well, are going to go out there and you're going to do work that matters and changes lives and opens hearts and pushes back when you see things are wrong. And I know because I've talked to you, and I know because I'll be watching you. We will be giving degrees in the Doctor of Public Health degree, the Doctor of Philosophy degree, the Post-Baccalaureate Certificate, the Master of Science degrees, and the Master of Public Health degrees. Dr. Kevin Scroth, Associate Professor in the Department of Health, Behavior, Society and Policy, and Dr. Emily Merchant, Assistant Professor in the Department of Urban Global Public Health, will be recognizing our graduates by degree. Ms. Claire Brown, Director of our Student Experiences and Alumni Affairs, will present our graduates with important information about staying connected to the school. But before we begin the reading of graduate names, we're going to pause for a moment to honor the memory of Erica Lenore Diedrichson. Erica is being awarded the Master of Science in Biostatistics posthumously. Erica was a dedicated student whose passion for public health and data science left a lasting impact on our community. I had an opportunity to spend some time with Erica's family today, and we extend our deepest condolences to her loved ones and recognize her accomplishments with admiration and respect. Erica. So I'm going to turn the mic over to Dr. Scroth. Let me just say something to you. When I went and got my real ID a few weeks ago, I got an appointment. I have to keep trying. I made the person take the picture 8 times, and then I got a good one. The photo you're going to get today, 1 time. So you better make it good. Dr. Scroth.
Thank you. Good afternoon. My name is Kevin Schroth. It's a pleasure to see you.
Dr. Schroth.
Thank you. Graduates, please follow the directions of the individual asking you to rise. In lieu of a handshake, you may choose to elbow bump the dean before posing for a picture with him. It is now with great pleasure that we first recognize our doctoral graduates from the class of 2025. We will now hood our Doctor of Public Health graduates. With the DRPH graduates of the class of 2025 and their mentors, please come forward. As your name is announced, please proceed across the stage to be hooded by your mentor. Dr. Erica Sison is being hooded by Dr. Vince Silencio. Dr. Olivia Ellison is being hooded by Dr. Michael Anestis. Dr. Yudalin Jaramillo is being hooded by Dr. Ali Gantz. Dr. Zachary Ehrlich is being hooded by Dr. Mitchell Rosen. We will now hood our Doctor of Philosophy graduate. Will the PH graduate and their mentor please come forward? As your name is announced, please proceed across the stage to be hooded by your mentor. Dr. Molly Nowles is being hooded by Dr. Paul Duberstein. We will now recognize our 2025 post-baccalaureate certificate graduates. Will the graduates of the class of 25 who are receiving a postgraduate baccalaureate certificate please come forward to be recognized? Jeffrey Fair. We now recognize our 2025 Master of Science in Biostatistics degree graduates. Will the graduates please come forward? Varalakshmi Poikala. Ridini Anand. Jacob Singer. Danielle Nasto. Alicia Lagarde. Elin Ma. Jai Wang. Roshi Ping. Hanjun Chen. Chile Shung. We now recognize our 2025 Master of Science in Epidemiology, Pharmacoepidemiology degree recipients. Will the graduates please come forward? Juillet Go. We now recognize our 2025 Master of Science in Health Outcomes, Policy and Economics degree graduates. Will the graduates please come forward? Yiru Chen. Efenu Hairunisa. Hiran Rasikbai Devani. Zuleika Shigon Maru. It is now my pleasure to welcome Dr. Emily Merchant to read the names of our Master in Public Health graduates.
Thank you, everyone. How lucky are we to be here today? It is my great pleasure to now recognize our 2025 Master of Public Health degree graduates. We are proud to recognize several inaugural graduates who are part of our Master of Public Health in Public Health Nutrition and Dietetic Internship Graduate Certificate Dual Degree Program. Will the graduates of the class of 2025 who are receiving their Master of Public Health degree please come forward to be recognized when a staff member asks you to rise. The external color of the Master of Public Health hood is salmon pink. This is the official color for public health and denotes the profession. Thierno Mustafa Diallo. Nicole Owens. Samuel Nemeth. Max Falk. Jessica Sandler. John Selby. Luis Araya Villaroli. Urij Uli. Swarnima Vishnoi. Azizat Ariwola. Ashley Patricia Alisaya. Devyani Yadiva. Carrie-Ann Molnar. Emily Height. Sebastian Plasencion. Kimberly Ann Gaswind. Rosanna Mazzio. Francesca Agnello. Shreya Karthik. Andy Weiser Schlesinger. Avani Dinesh. Neha. Ritisha Choundori. Alexa Fiore. Dalia Vasquez Lopez. Reem Al Sahil. Nida Bajwaj. Hayden Saint Sin. Vanessa Marin Gira. Ashley Mora. Fatima Ahmad. Lillian Itzi. Paula Medina Blanco. Emily Mowell. Anne Marie El Jendi. Ebtisem Tamer. Teresa Musa. Siham Musa. Suan Kim. Kai Beverly Bugnomi. Kina Eager. Tristan Murphy. Manisha Persad. Rihi Jane. Denise Rimple. Ong Han Win. Nicole Ureta. Frederick Apia. Devanshi Kothari. Natalie Barba. Lane Hoshield. Stephen Mary Konda. Nicholas DeLisi. Philip Macrellis. Christopher Warren. Zaria Rawls. Janitha Marshall. Jasmine Mary Allen. Cecilia Banks. Maria Pineda. Adriana de Risendi. Yashna Sharma. Jill Patel. Aisha Ula. Zenab Butt. Yaritza Rodriguez. Estelle Yike. Gu Shan Hong. Mrunalini Srinivas. Withatri Kadk. Rahim Mahmood. Tyrone Jeremiah Bowen, Jr. Christine Ogunleye. Eftihia Theodoraki Matas. Sarah Mehta. Kinichi Egbo. Arthur Pacheco. Sheena St. Felix. Sean Fairborn. Pooja Patel. Savan Patel. Angel Nugent. Denise Prempe. Emmanuel Sanon Jules. Frank Day. Keyshawn Frizzle Williams. Kiolo Colusin. Cecilia Poku. Shika Patel. Adam Fathala. Aaron Mulliken. Sajwa Pasha. Juliana Felix. Dana Schubert. Soleil Perez. Miriam Gergis. Hafsa Khan. Ivana Hill. Alejandra Murillo. Kareen Ali. Ose Saniga Iyamu. Sukaina Gay. Uye Libanga. Adeyani Adeleke. Fatumata Nyangadu. Fatma Bey. Susanna Sue Van Gelder. Tinashe Muzambi. Maya Catherine Hendel. Diego Perez Sideno. Natalia Sukolnike. Sahar Saeed. Melanie Doran. Rosalind ECK. Omo Bukola Buki Itua. Hilda Ukpokolo. Nahom Deleta. Salome Jenny Manu. Jessica Odell. Congratulations to all the graduates and their families, friends, loved ones, and guests. Dean Halkitis will now close the ceremony.
Thank you, Dr. Merchant. Should I sabotage Kevin's name again? You know, what's really interesting is like, I'm standing there shaking hands, looking at all these beautiful faces, different sizes, different shapes, different identities, different skin tones, diverse in every way. And look, none of us caught on fire. How is that possible? Huh. I guess diversity is a good thing. In closing, let me say first and foremost to our graduates, I am really proud of you guys. I really want you to go out in there and do it, kick ass, push back, question, challenge, do it all, man. I'm counting on you. This old body can't take much more. So you guys have to carry the weight. So I'm looking forward to that. In closing, let me say my appreciation also to Rutgers Health, the Rutgers University governing boards, and the university as a whole. I want to express to our staff and our students my sincere appreciation for making this convocation possible. Graduates, now get up and express your thanks with applause and screams and kisses and everyone to your loved ones right now. Thank you all for being with us right now for this amazing ceremony. Before I bring Rihanna out, no, she's busy. Families and guests, please stay seated until our platform party and graduates process out. Graduates, please wait for the platform party. This is the platform party. It processes out and follow the directions of the aisle staff. Claire Brown will now lead the platform party. Claire. Good afternoon, everyone.